Indeed, actually, we are living very exciting times at the moment in the United Nations. I'm sure you are all aware that there is a lot of discussion about the drug control system, taking into account also many of the issues that were just raised, and I wish I had the time to respond to and have a good discussion about what was just presented that was so interesting. But I promised Ina I would talk about health-centered prevention, and I will stick to that. Give me just 1 second that I get used to this thingy. Yes. So, well, what I will do is basically a bit summarize for you the key messages that come out from the international standards on drug use prevention that we have published together with the World Health Organization last year. This was the second edition. The first edition we published a few years back, and indeed, actually, the government of Norway was a big support in this endeavor. And I thought that that would be the best way to talk about health-centered prevention, because really, I start from, you might know, of course, Hippocrates, the father of medicine, that said, do no harm. That was his overriding principle. And for me, a health-centered approach, that's where it starts from, and really from trying to understand what works and what doesn't work and move our practice in this way. And this is what we did in the standards, really. Essentially, we just took the science that we could find from all over the world, and we summarized it to put it at the disposal of everybody. And normally, I have a little bit of discussion about how we did that, because I'm really eager for people to understand that we used a very rigorous methodology. In the interest of time, I will skip that, but of course, all of the documentation is available. For now, I just want to tell you that we really did try to reach out to the whole world. These are the experts where they were from all over the world. And also the studies. I told everybody, you know, give me studies, any language. If it's good science, I will find a way to translate it. I don't care. I'm not looking only at English or UN official languages. And we've sifted through a lot of studies. Let me skip immediately to what we found. And I've organized this around a few key messages. And I think that the first one is maybe, how can I say, you know, not so news to you, but in some context, I have to underline this, that the fact that we have the science to say that there are many strategies that are effective in preventing substance use. And please note, of course, we are working with the World Health Organizations, but in general, when we talk about prevention, we talk about prevention for all psychoactive substances. It makes absolutely no sense to distinguish between controlled and non-controlled substances. And this is the table. Where is Ina? Ina, there is a table also for the second edition of the standards. I know it is a bit difficult to read, and I will go through it. But for now, I just want to draw your attention to the fact that we have interventions that target very early ages, infancy, childhood, and then, of course, also intervention for adolescence and adulthood. And we have interventions that target the family, the school, the community, the workplace of the health sector, much more than the usual prevention is a campaign, a media campaign kind of thing. And I think this is because, and this is the message number 2, the evidence-based prevention strategies prevent also many other risky behaviors, promoting the healthy and safe development of children and youth. And I think this is something that is very dear to your heart, and also from the introductory remarks of Ina. And I want to underline, what I'm talking about here is not that because you prevent drug use, you prevent the harms associated to drug use. That too, but what I'm really talking about is that if you do prevention well, according to science, you are addressing the same vulnerabilities that are at the basis of many other risky behaviors. And that is why, in reality, what we are doing, you are helping children grow healthy and safe, focusing on the child as opposed to the substance. And I want to give you for an example of this. So family skills training, okay, we have the evidence. These are programs where you work with parents and families for parents to be better parents and families to function better. You hardly talk about drugs, by the way. They do prevent substance use, including drug use. We have the evidence, but they do so much more than that. So we know now that also thanks to the research of the World Health Organization, that they prevent violence, particularly youth violence, so violence by youth. They also prevent child maltreatment, so they prevent violence by adults on children. They are very helpful in managing behavioral disorder of children and adolescents, so the early onset of mental health disorders. And they are able to promote the development of children also in very risky and difficult situations. And we are very proud to have been in more than 20 countries, almost 30 countries in reality, all over the world, implementing and piloting this kind of programs and showing results in scientific journals. And for those of you who might be interested, I have a few brochures just to tell you a little bit about the programs that we have developed that are in the public domain. They are not copyrighted by universities. They are not expensive, and they are tailored to the needs of low-resource settings. But let's go back. So close the parentheses, just giving you the example of our programs, and let's go back to our messages. I think I've heard many people here already saying this. In many other countries where I work, this comes as news, but I want to underline it anyway, the earlier the better. And as I was mentioning, there are interventions that are effective at all ages and all stages of development of children. And so this is from that table that I was showing you before. These are the interventions that have been found to be effective very early on. So, for example, we have services for pregnant women. All pregnant women, and of course also pregnant women with drug use disorders, which can and should be offered voluntary and evidence-based treatment for their benefit and the benefit of the child, of course. For women that are expecting and are maybe in more marginalized situations, we have good programs of nurse visitations that have been found to be preventive and improving health and social outcome for the children even later on, and early childhood education. These are programs that you deliver in kindergartens, and basically you help the child develop, particularly their personal and social skills, but also the cognitive skills, but also you support the families. These are programs that you deliver in maybe more difficult communities, and I want to show you some of the results that you can get from this kind of programs. So they followed a group of kids that did the intervention in kindergarten. This is the blue group, and a control group, and up until the children, now adults, became 21, and they collected data. And at that point, the children that had gone through the program had using marijuana less in the past month, there was less teenage pregnancy, and there was more enrollment in college and university. So when I talk about, improving the development chances of children and youth, these are the kind of results that I'm looking for, and that the interventions that are in the standards can provide you. Moving on to middle childhood, again, you know, in the first bit, you saw that what are the important ones, the school and the family. Well, school and family for middle childhood, kids that are 5 to 10 years of age are still very important. So parenting skills training, I've already talked about this, but there is a lot that you can do in schools to support the development of personal and social skills of the children. Maybe not so much relevant here in Norway, but in many countries it is. School is protective by itself. Policies to keep children in schools are key to any national prevention strategy. And in middle childhood, for children that show early onset of mental health disorders, that is your chance to really turn around the trajectory of that child that could, you know, become, develop in a relatively negative trajectory and really help them get on track. Early adolescence, 11 to 14 years of age, another key age where parenting skills is super important still, and you have all those programs that have been found to be effective in schools. And they are all around, again, developing the personal and social skills of the children, or, how can I say, strengthening their participation and attachment to the school. There is another group of programs, very new, very exciting, new research that I hope will develop that start to address the temperamental vulnerabilities. You might know that children that are sensation-seeking, looking for strong emotions all the time, and impulsivity are more at risk of initiating and developing drug use disorders. Well, I mean, there are programs that work with these children and teach them is a way to deal with the strong emotions that sometimes they feel without resorting to negative coping skills like getting drunk or using drugs, but in a positive way. And as I said, you know, it's not your first line of prevention, but in a country maybe like yours where there is already a lot, oh my goodness, 5 minutes, a lot of support, this might be very exciting. Let me move on before and let me regroup a little bit. Here, I just want to show you that if you use good prevention concurrently, you get more results. So if you use nothing, this is what you get. This is only school, and this is school plus parenting. And these are data for meth use, meth initiation, but we have the same data for example, for opioids, for prescription opioids, so it's very generalized. It's never too late. There are many things that you can do around adolescence and adulthood, and around tobacco and alcohol policies, and of course, multi-component programs in the workplace and communities and entertainment venues. For media campaigns, we have very not so strong results, but we are looking for ways to use them more usefully, particularly around supporting parents. But this is the last message, and this is where I want to spend my last few minutes. Let us use our resources better. This is a graph that I have invented, and I have copied from a study of the World Bank on how to optimize the use of interventions against HIV, in HIV prevention. And basically what they were saying is that if we move from non-evidence-based practice to evidence-based practice, even within existing resources, we can already make a huge difference. Money will always be a problem, but at least we can use the resources that we have better. And what we are talking about really is to implement with fidelity a set of activities that has been scientifically evaluated to be effective. It doesn't matter what it is. It might be in the standards or not. But if you have a scientific evaluation, and what I mean is not 90% of the kids in my program were very happy to be in my program. I'm very happy for you, but this still doesn't tell you anything about impact. But if you have a scientific evaluation, that's where we want to go. And the standards can tell you a little bit about this. So for many of the strategies, we have a good list of things, of characteristics that are linked to good results and characteristics that are linked to not so good results. So you can do prevention education in many ways, but we know that if you only provide information, you use only lectures, you focus only on self-esteem or on moral choices, or you use people in recovery as testimonials. People in recovery can do anything. But what we are talking about is using them as testimonials within a prevention program. These things have been found to be linked to no good results, or no results, or even iatrogenic results. And here we know that these are the things that have been found to be more linked to positive results, like focusing on social skills, discussing the normative nature and the expectation around use, and the perception of risk without exaggerating, like Ina was reminding us, using interactive, not like I'm doing now, interactive techniques and various sessions with trained facilitators. You think, duh, you would be surprised in how many countries none of this happens. So this already can, I always say, please evaluate. You know, you do different and you have good results with the scientific evaluation, I'm happy. I will change the standards. Give me the study. But if you don't, maybe this will give you an idea where you are in this, if you are on the right track. And ultimately, I think I want to remind ourselves that we are here to do better, because we are doing it for the kids, right? We are doing it for their healthy and safe development. So I hope you join us. We can do it together, and we can collaborate to promote this, what did you call them, Ina? A safer drug policy, also on prevention. Thank you very much.